What's your name?
Marilyn Roberts.
And what do you do?
I'm a radiology practitioner assistant. I perform various x-ray exams as well as read exams with the overview of a radiologist.
Why did you choose to do this profession?
It just seemed really interesting. I actually saw parts of a TV show years back where they were looking at films on a view box actually in a coroner's office, and I just found it really interesting, and I decided to go to school for it, and here I am.
Where do you work?
Grove Diagnostic Imaging.
And how long have you been doing this?
A little over 14 years now.
Are there other ways of imaging the body?
Yes, there's ultrasound, CT, which is computerized tomography, and MRI, which is magnetic resonance imaging.
What kind of procedures do you do on a typical day?
The most common thing is fluoroscopy. That's an actually live look during an exam or dynamic study versus a standard still picture of an x-ray. And I usually look at the GI tract. I have patients drink to look at their esophagus, stomach, or small intestine. When we're looking at the lower GI, it's inserted retrograde through the rectum, so we evaluate the entire GI tract from one end to the other. I also look at the urinary system, looking at the kidneys, the ureters, and the bladder, and that can be either injected through the veins or instilled through the bladder. I also do female exams to check their uterus and the fallopian tubes for infertility, or for people that no longer want to become pregnant and they've had a procedure called the Escher procedure, putting wires in their tubes to block the tubes for pregnancy. I also do exams for injections of joints. Patients that are going to CT or MRI to have better evaluation of their joints, I put contrast in their joints to better enhance those images. Face the board for me. And just roll your shoulders forward. And now for the second x-ray, I would turn him to his side, raise his arms, all the way up over your head, please. Right there. And again, tell him to hold really still and take in a deep breath and hold it. Another common one would be for the abdomen. You bring it down a little bit lower, touch his entire abdomen. And the machine also comes in a little bit closer. And down again to match the cassette. And that will get his entire abdomen.
So do you wear anything to protect yourself from the radiation?
Yes, we wear lead-lined clothes. I wear a two-piece outfit. It's got the skirt and the jacket. Basically, this keeps me protected front and back. If I turn myself to the x-ray machine, I'm still protected in the back. It also comes with a thyroid collar to protect your thyroid, which is very sensitive to radiation.
What about patients? Do they get protection too?
We protect their reproductive organs if they're in the younger age bracket of reproducing, and if it's not in the way of the image. So like example, if I'm looking at the upper part of the body, I can protect them. Grab that. And we just shield them in a skirt, depending on where the radiation is coming from. We either wear it on the front or the back to protect their reproductive organs.